Okay, good morning everyone. Thank you for joining us here, and we acknowledge that we're gathered on Blackfoot territory, and we recognize the Métis people who share a deep connection with the land. My name is Rob Miyashiro. I'm the Alberta NDP candidate for Lethbridge-East, and I'm joined today by my fellow candidate and current MLA for Lethbridge-West, Shannon Phillips. This election is about fixing the healthcare crisis. Everyone behind us have felt the effects of the UCP's disastrous healthcare policies in our community. Everyone here behind us has lost a family doctor, or has needed a walk-in clinic, or has trouble finding a specialist, or can't even book basic lab work. This is a city of over 100,000 people, and we don't have basic healthcare anymore because of the UCP. So we've come together today to talk about better healthcare for the people of Lethbridge. Family physicians are a critical part of community care. They are the front line, the first defense, and sometimes even the first contact we have with a healthcare professional. Family doctors are the key to unlocking the right kind of care at the right time. We see them for routine checkups, which can sometimes uncover more serious conditions before they become critical. We visit them as newborns, pregnant mothers, as seniors, when we enter a new phase of our life, or need help with navigating changes to our health. Often, they catch on to these changes and manage to keep us out of the emergency room. But sadly, 1 in 3 people living in Lethbridge do not have access to a family doctor right now. And we're seeing the effects of this shortage wreak havoc on our community. As a direct result of the UCP's actions, while they ripped up the doctor's agreement, they made it very hard to start or continue a practice, many have left the province or retired early, or just left the profession altogether. The UCP has spent the last 4 years making healthcare in Lethbridge worse. They've failed to invest in students, seniors, and young families. They've ignored our doctors and nurses' pleas for help and chose to fight with them instead. Now, our community is stretched thin. There are no family doctors accepting new patients right now. Not because they don't want to, because they're over capacity and underfunded. They can't keep up with demand. This is not a sustainable situation, and the people of Lethbridge cannot access the care they need. Family doctors, pediatricians, OBGYNs, we're short across the board. Asking a mother undergoing labor to travel 2 hours to give birth is unthinkable. But many living in Lethbridge have no choice, and in fact, they were told by their own premier, hey, make the drive. The Alberta NDP are committed to ending the UCP chaos in healthcare. And we will do that by rebuilding the foundation of primary care. I'm going to pass it over to Shannon, and she's going to share more about our plan for a better future. I'll grab this.
Thank you. Well, thank you, Rob. Okay, everyone, and I want to thank everyone who is behind us, concerned citizens here in Lethbridge, who have all had their own challenges in accessing the healthcare system over the last 4 years of UCP chaos in healthcare. We're joined by folks here in Lethbridge who are young and older, folks who are of all diverse backgrounds, people of all different professional backgrounds. There's even one retired physician behind us here. We have so many challenges in healthcare that can be traced back to the UCP war on doctors and frontline health services. But there is a better way. There is a better plan. Our family health team's plan is built around people's priorities here in Lethbridge. We have heard, Rob and I, in knocking on thousands of doors, people want a focused plan for a new clinic here in Lethbridge. We will deliver it. In Lethbridge, people want walk-in clinics to return, something as basic as being able to get a prescription for a kid with strep throat at 10 o'clock at night. This is something that we should be able to access here in Lethbridge, and right now we can't. Rob and I will deliver that walk-in capacity again. In Lethbridge, people tell us all the time we have healthcare worker shortages. People want us to train, attract, and retain healthcare workers and treat them with respect once they do provide services here in Lethbridge. So, through our investment in post-secondary and our commitment to stabilizing the healthcare system, Alberta's NDP, Rachel Notley's team of candidates here in Lethbridge will deliver on that promise. Now, our proposal around family health teams is simple. A family health team can include multiple family doctors, as well as nurse practitioners, registered and licensed practical nurses, mental health therapists, pharmacists, social workers, dietitians, community paramedics, community health navigators, physiotherapists, midwives, speech language therapists, and others. A family health team ensures that all Albertans have access to a family doctor or other health professional, not 2 weeks or 2 months from when they need one, but in a matter of days with hours that make sense for families and their work schedules. We will establish 40 new family health clinics across Alberta, and at least one of them will be here in Lethbridge. And we will invest in hiring 4,000 allied health professionals in primary care. In the coming days, Rachel Notley will share more about our recruitment and retention strategy to make sure that we can rebuild what the UCP has dismantled over the past 4 years. Now, a big part of that is how we here locally can work with Lethbridge College and University of Lethbridge to expand opportunities for young people right here in southern Alberta. Rob and I have knocked on thousands of doors over the last couple of years, and we know that families are deeply concerned about the serious damage that Danielle Smith and the UCP have done to public health care. The folks behind me share those concerns. But folks also know that they can count on Rachel Notley and her Alberta NDP team to bring a stable, caring, and competent approach to strengthening public health care. Thank you.
Hi, my name is Eloise. I'm with Global News. We do know that there have been around 17 family doctors committing to Lethbridge, a recruitment process going on with the city as well. I'm just curious what exactly the NDP will do differently to recruit those physicians to the city.
Well, Lethbridge lost at a minimum 40 family physicians, and now the UCP has said that by the end of the year there are likely to be 17 to replace them. It's been a long time since I was in school, but 17 out of 40 is still a failing grade. They have dug a massive hole with their war on doctors and war on healthcare. And we cannot trust Danielle Smith and her misplaced priorities, which include making us pay for a family doctor, which include distractions and telling folks here in Lethbridge to drive up to Calgary to have their babies. We cannot trust the UCP to solve the problem that they created in the first place. We can only trust Rachel Notley for better healthcare and better leadership.
So what will your recruitment process?
Absolutely. Well, first of all, we need to reinvest in our post-secondary system. That's the first piece. We need to make sure that those spaces are funded in our post-secondary system and that accessing that post-secondary education is affordable. And we've made those commitments around tuition freeze and better funding for post-secondary institutions. There are more ways that we can attract, retain, and train healthcare workers, and Rachel Notley is going to have more to say about that this week.
Yeah, if I could just one more specific to hospitals, we've obviously heard over the last few years the pressure on those workers as well, in emergency and whatnot. So what part of this family health team will work with hospital staff?
Right, so it keeps people out of the emergency room. And one of the things that I've been worked in prevention, early intervention services is if you help people before this problem gets to a crisis, there's no crisis. So if our family healthcare teams can find the problems that folks like these are having before it becomes a trip to the emergency room, they're not going to go to the emergency room.
We'll just wait.
Hi, Sean Mark, CTV News. Now, over the past few years, and for a long time coming, we've seen difficulties within our healthcare system in supporting Indigenous communities, there's trouble navigating the system, or even the social issues that come alongside with that. Now, what are you looking to do to try to improve on that moving forward?
Sure. Well, this is the reason why we came forward with such a detailed plan around family health teams, because we know then that we can tailor services in a way that is culturally appropriate, that speaks to the specific needs per community, and that we can make sure that those wraparound services are there for folks. Oftentimes, in order to do that, it's not just a family physician working in isolation, and that's why we are talking about all those other types of healthcare support to meet need in a way that's culturally appropriate. I'll also bring us back to the housing piece around restoring housing affordability. That's one of the main social determinants of health, is whether we have an adequate and affordable roof over our head, regardless of our background. But certainly our housing plan has promised $120 million into Indigenous housing initiatives. And there too, when as appropriate and as culturally appropriate, there are some times when that permanent supportive housing piece is required, and the transitional housing piece is required. We need to invest in that, and that too can serve as something of an early warning system for various health challenges that we can make sure that we are addressing essentially before they become crises in an emergency room.
Very much a follow-up.
Hello, Stephanie Thompson with the Lethbridge Bureau. My question for you regarding the healthcare is we're seeing an increase of inflation at the moment. What is the plan moving forward with the increase of doctors and hospitals with the challenge of the inflation? How is that going to be balanced?
Well, certainly folks throughout Lethbridge have had cost challenges, and that is why an Alberta NDP government will ensure that you never have to pay for a family doctor, as Danielle Smith has repeatedly indicated that she thinks is a great idea. So that is the first thing. That is a bad idea. That can only hurt people of all backgrounds here in Lethbridge and across the province. Now, as for our physician agreement, what we won't do is tear up a physician agreement right in the middle of a pandemic and make a healthcare crisis that prevailed everywhere around the world much, much worse, as they did here in Alberta, as the UCP did. A stable, predictable physician agreement so that physicians can see their future here in Alberta, so that they have stability and predictability, so they can invest in their practice, so that they can put down roots in our community. That is what people know they can trust Rachel Notley to deliver.
Hello, Tyler Hay with CJOC News. What will the NDP do to recruit people into post-secondary programs to help fill this shortage and to ensure that they're affordable and accessible for people?
Well, so far on our list of commitments, and there's more to come on this, so I'm going to give you a necessarily less satisfying answer than you might want, simply because Rachel Notley will have more to say about that this week in terms of our platform commitments around healthcare recruitment, attraction, and retention, and training. However, what we have seen in this city alone, $20 million of cuts to the University of Lethbridge. That is a massive dollar figure to be taken out of a city of only 100,000. That's had a tremendously negative effect on our economy, on our jobs situation, and on people's desire to move here and put down roots and create a life here in Lethbridge. So we will have work to do on restoring a lot of that funding. We've also committed to a freeze on tuition, and to ensure that that is not adversely affecting post-secondary institutions. We have also indicated that we are looking at ways to expand affordability around needs-based bursaries and scholarship programs. So those are just some of the commitments we've made so far, but there is more to come there.
No follow-up?
Okay.